Good day everyone. So for today's video, I am going to assess about the neuromuscular system, the cranial nerves. So first, we are going to go to the preparatory phase. So reassess the client's previous medical records if available. This is to establish guidelines for the content, maintenance, and confidentiality of the patient. So here I have the previous medical records. Next is to determine the scope of assessment needed. So prepare necessary equipment. So it is to gather relevant information on why the patient seeks medical health care. Then having equipment available saves time and energy. It also facilitates accomplishment of the procedure. So I have already my equipments prepared. So next is to perform hand washing and don gloves if deemed necessary. This is to prevent the spread of microorganisms, and gloves protect the nurse against the exposure to blood or bodily fluids. So I am going to use alcohol-based hand rub. Um, Next is to assemble equipment and supplies needed. This is for organized workplace and easy access of the equipment you will be needing. So here. So also I have my gloves already prepared here. Next is to introduce self and verify the client's identity. This is to ensure that the right patient will be receiving the I will be assessed and to help prevent errors. This will also serve as a good way to establish rapport with the client. So, good day, ma'am. I am your student nurse for today. I am John Ryan S. Backup. So, what is your name, ma'am?
Hello, my name is Angelisa Serrano Paki.
Okay, ma'am. Then your age,
I am 19 years old.
birth date, ma'am.
On March 23, 2002.
Okay, ma'am. Next is to explain the procedure to the client. So, explanation helps relieve and allay anxiety. It also facilitates cooperation. So, ma'am, today I am going to assess your neuromuscular system, especially the cranial nerves, ma'am. So, I just want your full cooperation, ma'am, so everything will run smoothly.
Okay, sir.
Thank you, ma'am. So, next is to position the patient comfortably and provide privacy. This is to ensure that the client um, client is comfort as well as secure client's privacy and confidentiality. So, ma'am, are you comfortable with your position right
Yes,
now,
sir.
ma'am?
Okay.
Okay, ma'am. So now let's go to the assessment phase. So assessing mental status. This is useful in helping differentiate between a variety of systematic conditions as well as neurologic and psychiatric disorders ranging from delirium and dementia to bipolar disorder and schizophrenia. So first is to assess level of consciousness by asking client questions. So, ma'am, can you state your name again, ma'am?
So again, I am Angelisa Serrano Paki.
Okay, your age, ma'am,
I am 19 years old.
and your birthday.
March 23, 2002.
So, are you informed, ma'am, where are we right now, ma'am?
Yes, sir. We are at your clinic, sir.
Okay. Then, do you know what day is today, ma'am?
It is July 22 on Thursday, sir.
Okay. Normally, client is alert and oriented to what is happening at the time of the interview and physical assessment. So, respond to your question and interacts appropriately. It is not normal if the client is not alert to person place, day, or time and does not respond appropriately. So, next is to observe the appearance, behavior, and the speech. So, while I did the interview lately, I have already observed the appearance, her behavior, and her speech. So normally, client is dressed appropriately with the occasion and weather, and dress varies depending on individual preferences. So client is also clean and groomed appropriately for occasion. The behavior is cooperative and purposeful in her interaction with others. The speech is an moderate tone, clear and with moderate pace. Furthermore, responses may sometimes be slow. On the other hand, uncooperative bizarre behavior may be seen in the angry, mentally ill, or the violent client. So, anxious clients are often um, fidgety and restless. So some degree of anxiety is often seen in ill clients. Apathy or crying may be seen with depression. So slow, repetitive speech is a characteristic of depression or Parkinson disease. Loud, rapid speech may occur in manic phases of bipolar disorder. So next procedure is to observe the mood, feelings, and expression. So, um, so ma'am, how are you feeling today, ma'am?
I'm good, sir.
So you're feeling well, ma'am.
Yes, sir.
So what are your plans for the future, ma'am?
So basically, I'm still studying right now. So I want to finish my degree and to help others, sir.
Okay, ma'am. So, normally, client is cooperative or friendly, expresses feelings appropriate to situation, verbalizes positive feelings regarding others and the future, expresses positive coping mechanism like support groups, exercise, sports, hobbies, and counseling. On the other hand, flat affect euphoria, anxiety, fear, ambivalence, irritability, depression, and rage are all examples of altered mood expression. So, so next procedure is to observe cognitive abilities, thought processes, and perception. Um, so, ma'am, can you tell me more about your future, ma'am?
So, as what I have said earlier, so I want to help others like community services. I want to um, give some foods and any materials that can help others.
Okay, ma'am. Thank you, ma'am. So, normally, client expresses full, free-flowing thoughts, follows direction accurately, expresses realistic perception, is easy to understand and make sense, um, does not uh, does not voice suicidal thoughts. Um, Abnormal processes include persistent repetition of ideas, uh, illogical thoughts, interruption of ideas, invention of words, or repetition of phrases, as in schizophrenia, rapid flight of ideas, repetition of ideas, and use of rhymes and punning. Now let's go to the assessing of cranial nerves. So we are now going to be assessing the cranial nerves. It is used to identify problems with the cranial nerves by physical examination. So each test is this. designed to assess the status of one or more of the 12 cranial nerves. So, for all assessments of the cranial nerves, have clients sit in a comfortable position at eye level. So, ma'am, are you comfortable with your position, ma'am?
Yes, sir.
Ma'am, so first procedure is to test for the cranial nerve 1 or the smell. So, um, okay. So, ma'am, I want you to close your eyes, ma'am. Then, can you occlude one nostril, ma'am? So, ma'am, I am going to let you smell some objects, ma'am. So, tell me, ma'am, tell me what do you smell, ma'am?
It's I mean cologne.
Ah, okay, ma'am. How about this, ma'am?
It's alcohol.
Thank you, ma'am. You can now open your eyes. So normally, client can smell and identify scent correctly. It is not normal if client is unable to smell or correctly identify smell. So next procedure is the testing of the cranial nerve 2, um, the optic visual acuity and the peripheral vision confrontation test. So, okay. So, ma'am, I want you to cover your right eye, ma'am. Then I want you to hold this, ma'am. And tell me what is this, ma'am?
E
Okay, ma'am. About this?
for A and 1, sir.
Okay, ma'am. Thank you, ma'am. So, can you go cover your left eye now, ma'am?
So there's C, Z, 1 and 9.
Okay, ma'am. Thank you, ma'am. So normally, client has a 20 out of 20 vision. It is normal if client can read Snellen or is squinting. So next is the assess visual fields of each eye by confrontation. So, ma'am, I want you to follow my finger, ma'am, ha? Okay, ma'am. Okay, ma'am. So normally, client should see the examiner's finger at the same time the examiner sees a delayed or absent perception of the examiner's finger. It's not normal and indicates reduced peripheral vision. So now let's go to the three testing of the cranial nerve of uh, 3, 4, and 6. This is the oculomotor extra ocular muscle movement, the trochlear, and the abducens. So because these nerves work very closely together, they are often examined as a group. So first is to check position of upper eyelid when the patient looks directly at you. Eyelids should be symmetrical and should not obscure pupils. So inspect pupils should be round and approximately the same size. So ma'am, can you look directly at me, ma'am, as I observe your eyes, ma'am? Okay, ma'am. So next is to hold finger about 10 centimeters from the patient's eyes and look for pupillary dilation on client's distant gaze. So check for extraocular movement. Stand 2 to 3 feet in front of the patient and ask him to follow as your fingers as you make an edge in the air. So ma'am, I want you to know what I am going to as I draw something out of air, mama.
It is letter H, sir.
Okay, ma'am. So movement should be symmetrical and conjugate. So next is to assess the pupillary response to light, direct and indirect, and accommodation in both eyes. So, ma'am, I am gonna spot you with this pen light, ma'am. So I want you to face here, ma'am. Okay, ma'am. So test cranial nerve 5. So this is the trigeminal. So the facial movement and sensation. So um, as a test motor function, so ask the client to clench the teeth while you palpate the temporal and the masseter muscle for contraction. So, ma'am, can you clench your teeth, ma'am, as I palpate you, ma'am? Okay, ma'am. Okay, ma'am. Um, Normally, temporal and masseter muscles contract bilaterally. Decrease contraction in one of both sides, asymmetric strength in moving in the jaw may be seen with lesion or injury of the fifth cranial nerve and is abnormal. So now let's go to the test for sensory function. So, ma'am, I am going to touch your forehead, your cheek, and your chin, ma'am, with this sharp or dull object, ma'am. So, ma'am, I want you to close your eyes, ma'am, and tell me, ma'am, if where I am pinching, ma'am, and if it is sharp or dull, ma'am. Okay, ma'am?
So here it is sharp.
Okay, ma'am.
So here it is dull.
Okay.
So here it is dull. So here it is sharp.
Okay, ma'am, you can all open your eyes, ma'am. Also, so normally the client correctly identifies the sharp and dull stimuli and light touch to the forehead, cheeks, and the chin. Now let's go to the test for the cranial nerve 7 or the facial test sensation anterior tongue. So let's test for the motor function. So, ma'am, I want you to follow as I say, ma'am. So, can you smile, ma'am? Can you frown and wrinkle your forehead, ma'am? Okay, ma'am. Then, can you show me your teeth, ma'am? Okay. Then, puff out your cheeks, ma'am. Then, lastly, ma'am, raise your eyebrows. Okay, ma'am. Thank you, ma'am. So normally, clients smile, frown, wrinkle forehead, show teeth, puff out cheeks, and raises eyebrows and closes eyes against resistance. Movements are symmetric. So now let's go to the sensory function. So, ma'am, I am going to dip this to either sugar, salt, or sweet, ma'am. So tell me, ma'am, ha, if what flavor did you taste?
It is salty, sir, so I think it's salt.
Okay, ma'am. Thank you, ma'am. Normally, client identifies the correct flavor. So now let's proceed to the test for the cranial nerve 8, the acoustic, hearing, and balance. So test the client's hearing ability in each ear and perform the Weber and the Rins test to assess the cochlear auditory component of the cranial nerve 8. So, So, ma'am, I want you to cover your right, I occlude your right ear, ma'am. So, I'm going to whisper some words, ma'am. So, can you tell me, ma'am, what did you hear, mama? So, and,
99.
okay, ma'am. So, I'm going to proceed to the other ear, ma'am. So, football.
Football.
Okay, ma'am. Thank you, ma'am. Then I'm going to use this tuning fork, ma'am.
So there's no vibration inside.
Okay, ma'am. Thank you, ma'am. So normally, patient can hear the vibration equally on both ears in the Weber's test. So next is the testing for the cranial nerve 9, the glossopharyngeal, posterior tongue, movement of soft palate, gag reflex, test for the cranial nerve X or the vagus. So, ma'am, I want you to open your mouth, ma'am, and say ah.
Ah.
Okay, ma'am. Thank you, ma'am. So normally, uvula and soft palate rise bilaterally and symmetrically on phonation. Also, check the client's ability to swallow by giving a client a drink of water. Also note the client's voice quality. Client swallows without difficulty, no hoarseness noted. So, ma'am, I want you to drink this water, ma'am. Okay, ma'am. So now let's go to the testing for the cranial nerve 11, the spinal accessory. Assess shoulders and neck muscle for strength and movement. So ask the client to shrug the shoulder against the resistance to assess the trapezius muscle. Um, so, ma'am, I want you to raise your shoulders, ma'am, up, then down, up, up. So, ma'am, can you So, ma'am, I want you to hold that for me, ma'am. So, I'm trying to, ma'am. So, stay still, ma'am. Okay, ma'am. Thank you, ma'am. So, normally, there is symmetric strong contraction to the trapezius muscles. So, next is to ask the client to turn the head against resistance. So, first to the right, then to the left. This is to assess the sternocleidomastoid muscle. So, ma'am, I want you to turn your head right, ma'am. Okay, ma'am. So, left. Okay, ma'am. Thank you, ma'am. So normally there is strong contraction of the sternocleidomastoid muscle on the side opposite the of the turned face. So next is the test for the cranial nerve 12, the hypoglossal or the tongue movement. This is to assess strength and mobility of the tongue. So ask the client to protrude tongue, move it to the each side against the resistance of a tongue depressor, and then put it back in the mouth. So, ma'am, I want you to insert here, ma'am. Ma'am, as you pull out your tongue, ma'am, I will be putting this tongue depressor, ma'am. So, I want you to resist, ma'am, ha? Okay, ma'am. The other side. ma'am. Thank you, ma'am. So normally, tongue movement is symmetric and smooth, and bilateral strength is apparent. Now let's go to the assessing of the motor and the cerebellar system. So, assess the condition, especially the tone and the strength, and movement of muscles. So, evaluate gait and balance. So, this is to assess the gait and balance. Then ask the client to walk naturally across the room. Note the posture, freedom of movement, symmetry, rhythm, and balance. Next is to perform the tandem walking. So the patient is instructed to walk placing one foot directly in front of other, then heel to toe. So, ma'am, can you stand up, ma'am, and go over there, ma'am? So, i-move naman dali. So, ma'am, I want you to do the tandem walk, ma'am. So, just follow me, ma'am. Just like this, ma'am. Then this. So, you continue, ma'am. Okay, ma'am. Yeah. Okay, ma'am. So, next is the heel, ma'am. So, can you walk like this, ma'am? Okay, ma'am. Then the toe, ma'am, like this. Okay, ma'am. Thank you, ma'am. So, normally, patients are able to walk without swaying. So, next is to perform the Romberg's test. So, ask the client to stand erect with arms at the side and feet together. So, note any unsteadiness or swaying. Then, with the client in the same body position, ask the client to close the eyes for 20 seconds. Then again, note any imbalance or swaying. So, ma'am, I want you to stay still, ma'am, and hold your position, ma'am. Both feet stay together, ma'am. Then, can you close your eyes for 20 seconds, ma'am? Okay. Okay, ma'am. So, you can now open your eyes, ma'am. So, you can now sit down, ma'am. So, next is the assess coordination. So, perform the finger to nose test. So, ask the client to extend and hold arms out to the side with eyes open. Next, say touch the tip of your nose first with your right index fingers, then with your left index finger. Then repeat this 3 times. So, ma'am, I want you to point at my finger, ma'am. Then touch your nose, ma'am. Then here, ma'am. Okay, ma'am. Again, ma'am. Here, ma'am. Touch here. Then here. So the left arm, ma'am. Here, ma'am. Touch. Here. Touch. Here. Touch. Okay, ma'am. Thank you, ma'am. So normally, client touches finger to nose with smooth, accurate movements with little hesitation. So furthermore, the client's dominant side may be more coordinated than the non-dominant side. So next is to perform the rapid alternating movement. So have the client sit down, then first ask the client to Touch each finger to the thumb and to the increased speed as the client progresses. So repeat with the other side. So ma'am, first let's start with your right fingers, ma'am. So ma'am, I want you to follow me, ma'am, like this. So let's start slow, ma'am. Then I want you to increase your speed, ma'am, as you go on, ma'am. So you can start now, ma'am. Okay, ma'am. So now let's proceed to the left. Same hangyapan, ma'am. Okay, ma'am. Thank you, ma'am. So normally, client touches each finger to the thumb rapidly. So next is to ask the client to put down the palms of both hands down on both legs, then turn the palms up, then turn the palms down again. Then ask the client to increase the speed. So, ma'am, I want you to follow me, ma'am. So, palms here, ma'am, then up, then down, up, then down. So, I want you to continue, ma'am, as you increase your speed, ma'am. Okay, ma'am. Thank you, ma'am. So normally, client rapidly turns palms up and down. So next is to perform the heel to shin test. So ask the client to lie down or the supine position and to slide the heel of the right foot down the left shin. Repeat with the other heel and shin. So, wait, ma'am. So, ma'am, I want you to lay down, ma'am. So, ma'am, I want your heel, ma'am, of your right, to go here to up, mama. Okay, ma'am. Again, ma'am. Last, ma'am. Ma'am, sige, ma'am. So, I want you to, so normally, client is able to run each heel smoothly down each shin. So, assessing sensory system, the sensory examination is used to determine areas of abnormal sensation, the severity and type of sensory impairment, and the extent of the involvement. So first is to so the first is the test like touch, the pain and the temperature sensation. So for each test, ask the client to close both eyes and tell you what they feel and where they feel it. So first is to test light touch sensation. So use a wisp of cotton to touch the client. So ma'am, I want you to close your eyes, ma'am. So, ma'am, I am going to touch you with something, ma'am. So, I want you to tell me what you feel and where do you feel it, ma'am. Okay, ma'am?
So here it is done.
Here.
Here it is done. Here it is done. Here it is done. So here it is done. So here it is done.
Okay, ma'am. So, you can now open your eyes, ma'am. So, normally, client correctly identifies the light touch. So, next is to test the pain sensation. So, use the blunt and sharp ends of a safety pin or a paper clip. So, ma'am, same procedure, ma'am. I want you to close your eyes, ma'am. Tell me what do you feel and where do you feel it?
So here it is sharp.
ma'am. So you can open your eyes, ma'am. So normally, client correctly differentiates between dull and sharp sensation over the various body parts. So next is to test the temperature sensation. Use test tubes filled with hot and cold water. So I am just using this. So ma'am, I want you to close your eyes again, ma'am. Same ma'am, tell me where you, what do you feel and where did you feel it?
So here it is cold. So here it is hot. So here it is cold. So here it is hot.
Okay ma'am. You can open your eyes, ma'am. So normally, client correctly differentiates between hot and cold temperature over various body parts. So now let's go to the test for the vibratory sensation. So strike a low pitch tuning fork on the heel of your hand and hold the base of the distal radius, forefinger tip, medial malleolus, and last the tip of the great toe. So ask the client to indicate what she feels, then repeat on the other side. So, ma'am, I am going to strike this, ma'am, at your different body parts. So, just tell me, ma'am, if what do you feel?
So there's vibration. Still there's vibration. Still there's vibration. So there's still vibration. There's still vibration. So here it is vibrating. So here it is also vibrating.
Okay, ma'am, on the other hand, ma'am.
So it is vibrating. So here it is vibrating. So here it is vibrating. Again it is vibrating. So still vibrating. So here it is vibrating. So here it is vibrating.
Okay, ma'am, you can open your eyes, ma'am. So normally, client correctly identifies the sensation. So now let's proceed to the test position sensation. So ask the client to close both eyes, then hold the client's toes or a finger of the lateral side and move it up or down as the client to tell you to the direction it is moved. Then repeat on the other side. So ma'am, I want you to first ma'am open your eyes. Then I want you to spread your fingers like this, ma'am. Then I want you to close your eyes. So ma'am, I am going to reposition your fingers, ma'am. So tell me, what position is it, ma'am?
Up, down, up, up, down, up, down, up, up, down.
Okay, ma'am. Can you open your eyes? So normally, client correctly identifies the direction of movements. So now let's go to the assessing of the tactile discrimination or the fine touch. So test for stereognosis. So place a familiar object in the client hand and ask the client to identify it. So repeat with the other object in the other hand. So ma'am, I want you to close your eyes, ma'am, and open your palms, ma'am. So, ma'am, tell me, ma'am, if you familiar with this object, ma'am.
So I think it's coin.
Okay, ma'am. How about this, ma'am?
It is hairpin.
Okay, ma'am. Thank you, ma'am. You know, open your eyes, ma'am. Um, Normally, client correctly identifies the object. Next is the test point localization. So briefly touch the client and ask the client to identify the points touched. So, ma'am, I want you to close your eyes, ma'am. So I'm going to touch you on some certain parts, ma'am. So tell me, ma'am, can you you will go you are going to tell me, ma'am. So where did I touch you, ma'am?
So here, 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 here.
Okay, ma'am. So normally, client correctly identifies the area touched. So now let's go to the testing for graphesthesia. So use a blunt instrument to write a number on the palm, then ask the client to identify the number. Repeat with other number on the other hand. So, ma'am, I want you to hold your palms out, ma'am. Then I want you to close your eyes, ma'am. So, I'm going to write a number on your palm, ma'am. So, tell me, ma'am, what number is it?
One, four,
Okay, ma'am. Thank you, ma'am. You can now open your eyes. Um, uh, Normally, client correctly identifies the number. So next is to test for extinction. So simultaneously touch the client in the same area on both sides of the body at the same point and ask the client to identify the area touch. So okay, so ma'am, I am going to touch you on symmetrically, ma'am. So I want you to close your eyes, ma'am. Then tell me, ma'am, where did I touch you, ma'am?
so here.
Okay, ma'am. Thank you, ma'am. So normally, client correctly identifies the points touched. So now let's proceed to the assessing for reflexes. This contributes to accurate diagnosis in many cases of neuromuscular disease. So, ma'am, I want you to position yourself here, ma'am. I-move na ang camera niyo. So, test for deep tendon reflexes. So, perform the bicep reflex. So, ask the client to partially bend the arm at elbow with palm up. Then place your thumb over the biceps tendon and strike your thumb with the pointed side on the of the reflex hammer. Repeat on the other side. Before the other. So, ma'am, I want you to bend your elbow, ma'am. Okay, okay, ma'am. Um, Elbow flexes and contraction of the bicep muscles is seen or felt. Next is to perform the brachiorajalis reflex. So ask the client to flex the elbow with the palm down and hand resting on the abdomen or lap. Use the flat side of the reflex hammer to tap the tendon at the radius about 2 inches above the wrist. So, ma'am, I want you to hold your palm like that, ma'am, out. Okay, ma'am. Okay, ma'am. Normally, elbow extends, triceps contract. So next is to perform the triceps reflex. So ask the client to hang the arm freely, limp like it's hanging from a clothesline to dry, while you support it with your non-dominant hand. With the elbow flex, use the flat side of the reflex hammer to tap the tendon above the olecranon process. Then repeat on the other side. So, ma'am, I want you to position your arms like that, ma'am. Okay, ma'am. The other side, ma'am. Okay, ma'am. Um, Knee extends, then quadricep muscle contracts. So, next is to perform the patellar reflex. So, ask the client to let both legs hang freely off the side um, of the of the examination table using the flat side of the reflex hammer. Tap the patellar tendon, which is located just below the patella. Repeat it on the other side. So for the client who cannot sit up, gently flex the knee and strike the patella. So ma'am, I am going to hit you this, ma'am, your lower patella. Okay, the other side. Ma'am. So normal response is plantar flexion of the foot. So next is to perform the Achilles reflex. So with the client's legs still hanging freely, dorsiflex the foot, then tap the Achilles tendon with the flat side of the reflex hammer, then repeat on the other side. So, ma'am, I want you to position your feet, ma'am, dorsiflex, like that, ma'am. I'm going to tap your Achilles, ma'am. Okay, ma'am, the other, ma'am. Okay, ma'am. So, in some older clients, the Achilles reflex may be absent or difficult to elicit. So next is to perform the ankle clonus. So place one hand under the knee to support the leg, then briskly dorsiflex the foot forward, the client's head. Then repeat on the other side. So ma'am, I want you to hold your legs, ma'am, then dorsiflex, ma'am. I'm just going to observe, ma'am, for shaking. Okay, ma'am, thank you, ma'am. So no rapid contractions or oscillation or the clonus of the ankles are elicited. So now let's proceed to the test for superficial reflex. So ma'am, I am going to let you lay down, ma'am. So I'm just going to get so yeah, there. Okay, ma'am. So next is to perform the abdominal reflex. So Lightly stroke the abdomen on each side, above and below the umbilicus. So move away from the umbilicus. So ma'am, I am going to slightly touch you with this, ma'am, away from your umbilicus. So normally, abdominal muscles contract. The umbilicus deviates toward the side being stimulated. Next is to perform cremasteric reflex in male clients. So lightly stroke the inner aspect of the upper thigh. Now let's proceed to the test for meningeal irritation or inflammation. So if you suspect that the client has the meningeal irritation or inflammation from infection or subarachnoid hemorrhage, assess the client's neck mobility. So, okay, ma'am, I want you to raise, ma'am. So I want you to flex your knee, then can you lean forward, no? And lean backward like that, no? So I am going to so there is no we're going to test for I observe for maneuver, and we're going to ask the patient for any pain or resistance. So, ma'am, is there pain, ma'am, or resistance? Okay, ma'am. So this means there are no Berdinsky sign and Krennic's sign. So you can now position, ma'am. So you can sit down, ma'am. So now let's this is to note that no pain is felt. Also, discomfort behind the knee during full extension occurs in many normal people. So now let's go to the termination phase. So first is to review the information obtained during the assessment phase and discuss the findings to the client. So present to the client possible plans to resolve health concern if present. So, ma'am, as I have gathered the assessment today, ma'am, there are no unusual findings, ma'am.
Yes, sir.
So, this is to validate accuracy of information gathered and identify appropriate care plan. So, next is to measure the client's understanding of the plan and the need for further teaching, provided that the client the opportunity to clarify, ask or raise any concern. So this is to ensure the client's understanding. So ma'am, do you have any concern or questions about today's assessment?
None, sir.
Okay, ma'am. So next is to end the interview politely. This will promote respect and positive relationship towards the client. So, ma'am, have a great day, ma'am, and thank you for your cooperation, ma'am.
Thank you, sir.
Next is to do aftercare, fix the equipment used, and arrange it properly. This is to facilitate and promote organization. Then perform hand washing. These prevent the spread of microorganisms. So I am using alcohol-based hand rub. Then document the findings in the client record. So this needs to be timely and accurate documentation. Um, this will promote detailed client information. Then documentation is for legal purpose also.